Okay, hello nurses and future nurses. Welcome back to my YouTube channel. And on today's episode of Nurse Clement B, I'm going to teach you how to give subcutaneous injection. That is, I'm going to use insulin for this procedure. So sit back and watch this video till the end. Do not forget to like, share, and subscribe to my YouTube channel at Nurse Clement B. Thank you for your support. Thank you for your shares. Thank you for watching all my videos. I really appreciate you. To my beautiful students, thank you for your support. Thank you, nurses around the world, student nurses around the world, student midwives around the world. Thank you very much. So for us to administer this medication, insulin, so the first thing you have to do as a nurse is for you now to check your prescription sheet to see the name of the patient, the drug that has been prescribed for the patient, right? So you pick your prescription sheet and check the name of the patient, the prescription. So this patient has been placed on soluble insulin, 10 international units. So I've seen the medication and I'm going to identify my patient. Remember, in nursing, identification of a patient is very, very important so that you will not perform procedure on the wrong patient, right? So let's identify our patients to know whether this is the right patient for us to perform this procedure. Hello, good morning. How are you today? So I am Nurse Clement and I'll be your nurse for today. Please, can you tell me your name, your full name, and your date of birth?
Lesson.
Oh, okay. And your date of birth?
9 January 2005.
Okay, thank you very much. So I am here to administer your insulin for you. Remember, your sugar level is high, and do not forget that whenever you're going to administer this kind of injection, most especially insulin, you just have to check the patient's sugar level. Already I have checked my patient's sugar level, already is high. Is high, so I have to administer according to the prescription, right? So since I know that her sugar level is high, remember I have checked your sugar level, the test I just carried a while ago, so that is why I'm going to administer this insulin to you, right? So okay, I'm going to give you your prescribed insulin, right? And I'm going to administer it on your thigh. So please, it's not going to be painful, but just a slight pinch sting that you feel, right? So can I go ahead? Okay, now that the patient have agreed that and she has consented that I should give her this, administer this medication, I'm going to prepare my medication, right? And before I continue this procedure, I have to perform hand hygiene and then don my gloves. So follow me, let's go and perform hand hygiene and don my gloves. So I'm going to don my glove for this before the patient is being placed on 10 international units of insulin. So I have to remove and discard, and then also clean the tip with spirited swab, discard in a receiver for your swab, and then remove the needle. After, when you allow the tip to dry, then you will draw the desired quantity units, right? So the patient is being placed on 10 international units of soluble insulin. So I recap and I place it inside receiver. Do not forget, whenever you're going to administer medication, make sure you check the color of the medication. Has the color changed? For this one, the color is still intact and the expiration date, the drug did not expire. So you have to observe the 5 right R's, right? The right patient, right time, right medication, right routes, and right time, right? So I have checked all my 5 rights and I've prepared my medication, and then I'm going to place my spirited swab inside this receiver and then my dry swab also inside the receiver and take it to the patient's bedside. I'm here to administer the medication, the one I have explained to you, and I'm going to administer it on the thigh of my patient, right? So you expose the patient's thigh and then clean the area with your spirited swab. After cleaning it in a circular motion, after cleaning it, right, then you remove the cap, also discard it, and then you pick your dry swab and then you inject this patient subcutaneously, right, 45 degrees. You inject the patient, right? Then you pull a bit back to make sure that it's not inside the blood vessels, right? So make sure that the needle is in the patient's adipose tissue, right? The fat, isn't it? After when you are done, then you remove the needle and then immediately you discard it inside a sharp box, right? You discard it inside a sharp box and then you make your patient comfortable. So now that I am done, I make my patient comfortable since she has consented and I'm done with the medication. I told her and it's not painful. The patient did not complain. She cooperated with me throughout the procedure. So thank you, ma'am. Thank you for staying with me till the end of the procedure. Thank you for cooperating. Now that I'm done with this procedure, it is left for me now to discard my use equipment, and then remove my glove and perform hand hygiene. So I will remove my glove, right? I'm done performing hand hygiene. So I have to dry my hands so that I can document, right? So after performing my hand hygiene, I take my patient's medication card and I record 10 international units of insulin given at 10 a.m. and patient is left calm on bed, right? And I signed, of course I will sign to indicate that I'm the one that administered that the medication, the insulin, of course. Thank you for staying with me till the end. Thank you for watching my videos. Thank you for subscribing to my YouTube channel, and thank you for your shares. And in case you have any challenge or any procedure you want me to perform, you want me to put on my YouTube channel, please can you please drop it at the comment section also and let me know so that I will do that procedure and upload it so that you can, anytime you want to watch, you can watch it. Thank you for your love. Thank you. Bye bye.